Welcome everyone to the first of 3 panels in our Science for a Sustainable Future series to commemorate Earth Month. We're holding today's webinar in Zoom webinar. Participants will be muted with cameras turned off, but please feel free to use the Q&A feature to send questions to our panelists. Today's webinar will also be recorded, and the recording will be shared after if you would like to view it again. And if you're dropped out of the webinar at any point, just use the same link you used to join us a second time. It's my honor and pleasure to introduce our moderator for today's session. Sir Andrew Haynes is a professor of environmental change and public health at the Center for Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. He also co-directs the World Health Organization Collaborating Center on Climate Change, Health, and Sustainability, and has practiced medicine around the world, including in the UK, Jamaica, and Nepal. He currently looks at the environmental influences on health, including the effects of climate change. Andy, the floor is yours.
Well, thank you very much, Lauren, for the introduction. So welcome from me to the first of 3 events in the 2024 Science for Sustainable Future series. And of course, the focus of today is on adapting health systems to climate change. And this is an increasingly central issue of our time, because it's very apparent now that climate change is having a range of impacts on human health, ranging from the obvious direct effects of extreme heat and other extreme events to effects on wildfires, increasing air pollution in some locations. A whole range of infectious diseases are affected: water-related, vector-borne diseases, emerging zoonotic diseases, effects on nutrition and food systems, and of course, potential for population displacement and increasing impoverishment. So it's vital that we do adapt as far as we can. Of course, there will be limits to adaptation, and mitigation is also essential. And mitigation actions will bring many very major health benefits through reduced air pollution, etc. But our focus today is on adaptation. And I'd like to introduce our first speaker, Professor Salome Bukachi, who is a professor at the University of Nairobi. She's a social and medical anthropologist. She studies community knowledge and practices in relation to livestock and zoonotic diseases, gender issues, and nutrition. And her research includes cultural aspects of food behavior, health systems, and the socioeconomic aspects of infectious diseases, and how climate is affecting these systems and behaviors. Over to you.
Thank you very much. I will look at aspects on how climate change has been affecting communities and how communities have been adapting to these climate change issues. So first of all is just to bring out that climate change issues impact on livelihoods. It impacts on communities and their behavioral practices. For example, drought impacts on water security. So you find that during drought, communities who live especially in areas that are affected by drought, especially the semi-arid and arid areas, have to go very long distances to be able to look for water. Of course, with this then comes the layered on aspects on the burden, the extra burden in looking for water, but also the water that they fetch, it may not be the right quality. And so that impacts on them. In relation to food security also, during drought, especially in areas where they depend on rain-fed agriculture, it impacts on the food systems in those communities. And so we find that livelihoods are affected. And likewise, when we look during drought situations, during floods also impact on communities in the same way. And sometimes we think that because there are floods, that there's water everywhere, that people are water secure. But again, water insecurity comes in during drought because the water systems are also impacted on by the drought aspects, as well as, again, the food security and the impact on livelihoods. But we have communities that have lived in areas where the environment or the climate has always been uncertain, especially when we look at pastoral communities who live in areas which sometimes are affected by drought and sometimes by floods. These communities have developed a close relationship between themselves, their nature, and their animals, and have learned to coexist with these situations. So one of the things that is important for us, even as we're moving ahead, is to just look at them and learn. How can we learn from the indigenous knowledge that exists? For example, in Kenya, there's a community in the northern part of Kenya who have been able to predict the kind of weather that will be there in the next foretell what kind of weather will be like. So working with such kind of communities in terms of using the environment to be able to foretell how the weather patterns will be can be an important resource that can be tapped into so that even the weathermen can work together with this indigenous knowledge from the communities and see how to build up in terms of early warning systems. But besides that, we also have situations where the climate change has impacted on our indigenous food systems. And so we are finding that there's a loss of some of our food systems, the traditional food systems, food seeds, the foods that we use traditionally. So it's important towards working towards how do we preserve some of the traditional foods, our traditional fruits, our traditional species, livestock species, so that then those can be used, because some of these species have been drought tolerant, but because of some of these climate change aspects, we are finding that these are being impacted on. So it's important for us to go back to some of those systems, and some of these traditional foods were very nutritious, were very rich in providing the necessary nutrients. So it's important that we go back to those systems and just work with communities who have indigenous knowledge. Also in relation to conserving the environment, communities had traditional systems in terms of conserving the environment. There are some sections of the environment which would be kept aside and say that communities are not allowed to graze in this portion of land. And there would be a rotation and a way that communities would work around it so that they would give time for regeneration of land so that they do not deplete the resources in the land. And so these aspects brings out the importance of us working together with communities, building upon the indigenous knowledge that exists in terms of conserving our environment, in terms of preserving our food behaviors, in terms of conserving our food systems, our traditional food systems, so that then that can also help us in terms of just adapting to the various climate change situations. Thank you.
Well, thank you, Salome, for getting us off to such a great start and also emphasising really the central importance of listening to community voices and particularly indigenous knowledge, incorporating that in adaptation strategies. So thanks for a wonderful opening, and I'm sure that will stimulate discussion and questions. I'm going to move on now to our next speaker. So we're going to take each of the four speakers in sequence and then move into the question and answer session. And the next speaker is Thierry Lefrançois, who has worked for more than 20 years at CIRAD, which is the French Agricultural Research Centre for International Development. He works on the diagnosis, epidemiology and control of tropical infectious animal diseases. And his research explores the emergence of diseases and the development of surveillance within the framework of regional health networks in the South. And he's a member of COVARS, the French Committee for Monitoring anticipating health risks. So over to you.
Thank you. Thank you so much to the organizer for the invitation, and thanks, Andy, for the nice introduction. I would like to start by saying that some effect of climate change on animal or human or zoonotic emerging diseases are well understood now, especially when we are dealing with vector-borne diseases, since vectors like mosquitoes or ticks are highly dependent of environmental conditions like temperature, humidity, and vegetation. And their geographical and temporal pattern is being modified, leading to change in the interactions between both pathogens and domestic or animals or human. But this is not restricted to vector-borne diseases. A very nice paper published in Nature in 2002 by Carlson and collaborators demonstrated that climate change will definitely increase cross-species viral sharing and transmission risk, including spillover, because it modifies ecological niche of pathogens, vectors, and hosts, and it also can modify evolution capacities of pathogens. Farrell, can you show the slide, please? Now I am going to move to the idea that to better understand this complex health risk, it is really necessary to anticipate them and understand them. The COVAS, which is a new committee which was implemented in France following the COVID-19 Scientific Council in order to help the government in anticipating and monitoring health risk. And the COVAS has worked and just provided to the ministers a report on health risk, which could occur in the next 2 to 5 years and induce a major impact on health system in France mainland and remote territories. As you can see on the slide, we have estimated the probability of occurrence, or the score of occurrence, I would say, and the epidemiological and clinical consequences considering the countermeasures which are available currently. We have identified in the top risk, in the black square, pandemic zoonotic influenza, a new pandemic coronavirus, but also several vector-borne diseases as dengue fever, but also Zika, chikungunya, or West Nile and Crimée-Congo hemorrhagic fever. What is interesting to notice is that all these risks are either zoonotic or vector-borne diseases. And we do consider that environmental factors will increase this risk in the coming years, as it is represented by the green arrows. But interestingly, we have also analyzed environmental risks, including climate change, biodiversity loss, and pollution, and their direct effect. I will not present the details of the result because they are very difficult to quantify, but we do consider that even if these environmental risks can be considered as more long-term risk, they are already impacting health system, either directly, like heat waves, cancer, or reproductive or psychological disorders, or by aggravating infectious disease burden through increase of occurrence, but also by increasing the vulnerability of population. For example, air pollution will induce chronic respiratory diseases, which is a major vulnerability for emerging respiratory pandemics. This highlights the need for a One Health approach, considering human health, animal health, but also environment together and as interconnected sectors in order to deal with multi-crises at all scale and with a scientific basis. Several initiatives have taken on board this principle, like PREZOD, which stands for Preventing Zoonotic Disease Emergence, which is an international scientific initiative with more than 250 partners from 60 countries, aiming at developing prevention and bottom-up approach, which is the involvement of community in the One Health surveillance system, as insisted the previous speaker. The overall objective is to be able to analyze and develop resilient and healthy territories and socio-ecosystem. Altogether, I strongly believe that the definition of health should take into account our changing and interconnected world, and therefore allow countries to set up health systems that are really targeting the current global change and challenge of health, climate, and biodiversity, as demonstrated by the overshooting of the planet boundaries. Thank you.
Well, thank you very much, Thierry, and for another great talk, I think summarizing a lot of important information in a very short time. So that's a wonderful introduction to the whole important topic of One Health and the interaction between human health and animal health and so on. Let me move on now to our third speaker. Great pleasure to introduce Madeline Thompson, who's the Head of Impacts and Adaptation at the Wellcome Trust, which, as I think everyone knows, is now funding a large amount of research in the whole area of climate change and health. But she herself has also had a distinguished career as a researcher in the field of climate change and health research. She worked as Senior Research Scholar at Columbia University's Mailman School of Public Health. And her research included methodologies and tools for improving climate-sensitive health interventions with a focus on infectious diseases and nutrition. Madeline, over to you.
So thank you so much, and it's such a pleasure to be on this panel. You've given a bit of an indication about Wellcome, but let me just expand on that for a moment. We're one of the largest philanthropic organizations in the world, second to only the Gates Foundation in terms of our endowment and spend on health. And we are politically independent, which is very important to us, and obviously financially independent based on our endowment. There's a commitment from the organization that was made last year to spend 16 billion British pounds on health research in the coming decade. And over the last 2 years, we have reorganized the entire structure of Wellcome to be able to deliver a new strategy, which has still the discovery research that was the foundation, if you like, and of Wellcome's work, but now 3 strategic areas: infectious disease, for which we're very well known, and Thierry will be aware of Wellcome's work in COVID response, both here in the UK and globally. Mental health, which is a new area really for significant investment in health, and then climate change and health. And of course, climate change and health is a very different type of topic as a health topic, which such as infectious disease, because it's really about bringing different communities together. And of course, we are interested in working internally, both with our infectious disease colleagues, as well as our mental health colleagues and our discovery team. But climate and health, as I say, it's situated in a very different space, and we need different types of research that are going to deliver in this area. And our focus has been, under the current programme and also under the previous programme, our planetary health that was held here at Wellcome, on transdisciplinary research, where the researchers are already working with the policymakers, with communities, with broad stakeholders relevant to the research area, so that the research translation has a natural path for delivery. Otherwise, we have seen in the past, in the way research funders fund, that we can get brilliant science, we get brilliant papers in Nature and Science, etc., and very little impact where it really matters on the front lines, particularly in most vulnerable countries and amongst the most vulnerable communities. So a transdisciplinary research approach is really central to our investments. And to say that, so we have already funded with our, we have a cross-cutting function called Data for Science and Health. We have already funded work with them on climate-sensitive diseases and how to model that with climate information. Looked at evaluation of heat adaptation strategies in low and middle-income countries. Invested in the biological vulnerability in maternal and child health as a group of very vulnerable individuals that has not been well researched so far. And it's fantastic to have a talk coming up on the maternal and child health aspects of climate change. We know historically there's a lot of work that's been done on heat, but the investments have largely been for the military and for elite athletes. So focusing on the most vulnerable is absolutely key. And then some of you may be aware, we've started investing in what we call climate impact awards, which yes, research is still an important aspect of these awards, or particularly research bringing research together, research synthesis, but then really tying that into community needs, clear policy objectives, and connecting the research community to the communication community, really trying to help researchers really expand their reach with their research, given that the urgency of climate change. And I think this is one of the challenges that we have working in this field, is that climate change, the longer we leave it, the harder it will get. And so we need the right research to be done now, and we need to focus our attention on the most important aspects of that in order to prevent longer, more difficult connections to emerge in the future. So I'm particularly pleased to be on this panel and to connect with the audience, but also with the other panelists who are obviously working in this space and doing very important work. So thank you.
Well, thank you very much, Madeline, for a really important perspective from the Wellcome Trust as the most important funder, really, of climate and health research globally at the present time, and also for emphasising the need not just for research rigour, but also to ensure that research has an impact on policy and practice. But it's now a great pleasure for me to move on to the final panellist, a colleague at the London School, based in the MRC unit in the Gambia. Uduak Okomo is the research coordinator for maternal and neonatal health at the MRC unit. She's a paediatrician and epidemiologist by training. Her research is focused on reducing newborn mortality in developing countries, particularly neonatal infections, infection control, and antimicrobial resistance. And of course, it's really of great importance that she and her colleagues are now getting involved in the whole arena of climate change impacts on maternal and child health. So Uduak, over to you.
Thank you, Andy, for the warm introduction. And I just want to thank everybody for joining us today. And I thank also the colleagues that have spoken before me, because they've kind of really set the scene and the stage for what I'll be talking about. Could you share the slide, please? And so I'm going to try to give a human face to really what we've been discussing. And Madeline talked about impacts, and we need to know and see really which communities, which groups of people are affected by climate change, and how this has really gone ahead to impact their lives. And so there's quite a lot of evidence growing epidemiologically that links climate change and events to adverse maternal and newborn outcomes. And climate change can have both a direct and indirect effects on pregnant women and newborns, and especially in areas where they have unequal access to prenatal care. And this can exacerbate health in healthcare inequalities. And so we can really say confidently that climate change is a threat multiplier in these settings. And there's so many ways in which climate change works and interacts with existing socio-economic and cultural contexts to magnify the impact of climate health. And I'll just go through a few of these. First of all, extreme weather events. And so these would lead to, hurricanes and floods. And what do these do? These disrupt communities, they disrupt infrastructure, and especially when you have heavy rainfall and floods and damaged infrastructure and critical services, there's loss of crops, there's population displacements, and what happens is that maternal and newborn health services are suboptimal, they're not functioning, or women have to go through very difficult conditions and terrains to access care. And these are already women that might have had inequities in receiving care in the first place. When you have extreme temperatures, they lead to health-related illnesses like heat stress in women. And this spans across the continuum, actually, of the life's course. So preconception, if the woman is exposed to heat stress, she's at risk of having hypertensive disorders and preeclampsia, and this increases the risk of having the baby to early preterm birth. For the baby in the utero, the high temperatures are associated with low birth weight and an increased risk of being stillborn and also preterm birth. And also maternal heat stress increases the risk of congenital anomalies in the baby. And for the newborn, when there's increased temperatures, this interferes with exclusive breastfeeding. The mother is dehydrated, the baby is not able to breastfeed properly, and also becomes dehydrated and also suffers from heat stress. And there's just all-round effects of mortality in the newborn. We also have effects of air pollution. The climate change contributes to air pollution, and this can harm maternal and fetal health with the pollutants, particulate matter, and irritants. And these have been linked to preterm birth and low birth weight, as well as developmental issues in the newborn. Of course, when there are floods and there's a change in the weather patterns, there's water and food insecurity, like Salome had mentioned, and women have to really bear the burden of providing for the families and the domestic care of the home, and they have to travel longer distances to get water. As she had mentioned, it might not even be of sufficient quality. The heavy rainfall also leads to mold, and crops are destroyed. So there's limited access to fresh and nutritious foods, and pregnant women may experience nutritional deficiencies, which also go ahead to affects the newborn. So the babies could be small for gestational age or premature. And so there's a risk of malnutrition from the women, as well as also waterborne diseases from contaminated water. There's also been a lot of work looking at vector-borne diseases. So the climate change influences the distribution and the prevalence of vector-borne diseases, and not just malaria, which is commonly talked about, but there are other things like dengue. And of course, we saw the Zika virus and what happened and the congenital abnormalities that resulted from that from Brazil. And so women, pregnant women are heightened, have a heightened risk of complications from these, including miscarriages and stillbirth. There's also an impact on mental health. The stressors, environmental stressors, the displacements, lack of food insecurity and water also have an effect on the mental health of women, leading to anxiety, depression, post-traumatic stress disorder. And of course, we know that women that's also prone to postnatal depression also has a multiplier effect on the newborn. And so to address this, the intersection of climate change and maternal health, we really need a lot of comprehensive strategies to look at that, improving healthcare access and enhancing disaster preparedness. But what's important is also that we really don't know the proportion of maternal and newborn mortality and morbidity that is attributable to climate change in these vulnerable populations. And this is something that we need to look at so that we can comprehensively estimate it and know what we're going to do to reduce this. Thank you very much.
Well, thanks, Udak, for another great presentation. I think we've had 4 really excellent presentations summarizing a lot of really important issues in a very short time. But now we have an opportunity for discussion, maybe to focus a bit more on some of the potential solutions. And we've got a couple of interesting questions in the Q&A, which I'd encourage you to put your own questions in there. The first one I want to address to the panelists is from Neelam Bhardwaj, I hope I've got that pronounced correctly. And she raises the issue which sometimes comes up in these events. Well, research is all well and good, but time is more important. We're just losing time. And is it more important just to act rather than getting good quality research done? Is there a tension between action and good quality research? So let me put that back to the panelists and get your views. How would you respond to that? Madeline, do you want to start?
I think that is exactly the challenge that we have, especially when we know the importance of good research, because bad research can lead us to invest heavily in things that don't serve communities, that don't give the results that we need, etc. But there's also so much research that has already been done that could be really helpful that is not being taken up. So I think really trying to focus on delivering what we know, the best of what we know, and making sure that that is available to decision makers and help in that uptake process is a really important part of our strategy. But at the same time, we still need to invest in things that we are uncertain about to be sure that the recommendations that go forward do have the best science behind it. And when I say the best science, I don't necessarily mean the best science because it's in an ivory tower somewhere with people in white jackets. What I mean by the best science is the most appropriate science that will deliver the answers for those particular communities. And that takes time, that does take time. So it is a bit of a, yes, we need both, but we absolutely do need getting knowledge into practice, the best knowledge that we have as soon as possible.
And of course, we can evaluate action while we're undertaking it. We don't have to wait. We can act on the best available evidence and evaluate what we're doing. But let me bring in others. I think, Salome, you had your hand up, and then Thierry.
Yeah, thank you for that very good question. And yes, it's important that we have evidence when we are taking action, but there are methods also that we can use to get rapid results in the face of a crisis that can help improve on the interventions that we give. For example, my background is in anthropology, and so we have these rapid assessments that we have been able to undertake in the midst of humanitarian crisis, and these have helped to shape and inform the interventions that have been done. So we don't have to wait, we can do it running together. Thank you.
That's a great point, Salome. And I remember also in Ebola, it was the anthropologist that in the end provided some of the vital clues that enabled the public health researchers to intervene more effectively. So absolutely right. Thierry.
Yeah, I perfectly agree with what was said by Madeleine and Salome. I would just had that research is needed for, especially for prevention, not only action during the crisis. And the more you work on prevention, the more you need technical capabilities and principal approach to work with a multidisciplinary and multisectorial way. And this has to be practiced during the peacetime in order to be effective during the crisis. And even during the crisis, you have seen that good research, as Madeleine has said, is really needed. And we have to avoid the bad research, and we need to continue research every time for sequencing capacity, for understanding the reaction of the public, for example, and is needed during the whole crisis. But what is true is that we need obviously applied research, which has to be built from the beginning with the idea of applied research and decision and to be developed with decision makers. We have to set up the interaction between science and decision again during the peacetime to know how to interact during the crisis. And I would say that we also need institutional and political action to complement the research and the science-based activities.
Yeah, really important points. And I think also that we can't just operate on a kind of demand economy. We also, on a supply economy. We also have to create the demand from policymakers for this kind of evidence and an acknowledgement of the importance of integrating this evidence into their decision making. So that's another thing that needs to be built up before we get to a crisis. Uduak, do you want to add anything to what's already been said?
Yes, I do. So I just want to add that also the fact with research is that it's not just one size fits all. And so what will apply in many settings would not apply in others. And so we start with what we know, but then in the process of implementing what we know, we find out that there are more questions that need to be answered. And so sometimes we find out that, like as Salome has mentioned, the methodology isn't right, or a particular intervention isn't appropriate for a particular community, or there's not even uptake of that intervention in the community. And so it's a kind of like a continuous cycle, evaluating what we're doing and doing more research to provide answers. Questions are generated, and we keep trying to find out the best answers.
Yeah. And of course, we have to be very much aware also of disinformation, and that can occur in all kinds of situations. I read yesterday or the day before that this disastrous ferry accident in Mozambique was related to disinformation about cholera. And so people were trying to escape from that in an overloaded ferry, and sadly they died. So disinformation can be a problem in all contexts, really, and we need to anticipate that with better ways of combating it. We've got a lot of other questions in the Q&A, which I'd like to move on to. One of them is from Thea Shearer, and this one is particularly to Madeleine, but others are welcome to comment. Is there more that research publishers could and should do further to enhance the impact of research in policy and practice, especially perhaps in those areas and geographies that you referred to? So yeah, I think, Lauren, did you want to also respond to that one?
I'm sorry, I was just trying to mark it as done. Madeleine should take it.
Okay, Madeleine's going to go ahead. Looks like you wanted to do it.
That's a great question. And of course, you know, you can't ever say there's enough being done. So first of all, yes, of course, there's more that needs to be done. I think that, and obviously we invest significantly in published research, because that is a really important form of communication. And it's important as well because it allows peer review. So other people see what has been proposed and can then critique it. And as a result, we all move forward in a better way. So publications are incredibly important. I think that what we have, though, is a kind of perverse system where academics who really want to deliver impactful work on the ground are impeded from doing some of that because their career trajectory, their departments, etc., are all being recognized largely through academic publications, many of which are cannot be applied directly. And there's a lot of other work that needs to be done. So I think that the publications are important, absolutely. But the way that we judge academics' contribution needs to be much broader than just publications. That would be my first thing. And that's one of the things we're trying to do through our program, is recognize what is the impact as opposed to, do you have a paper in Nature, etc. Not that it's a bad thing, it's just that there are other things to get done. In terms of how they can add, we work obviously through with the Lancet to support the Lancet Countdown, which is a flagship publication that we have been supporting for a number of years. And so those partnerships with publishers are also important because they're about developing a community of researchers and engaging in a policy discussion, etc. So I think that the role of publishers, very important. More could be done, I think, though, in this interface between getting the research into action, and maybe there's more activities that can be done there.
Okay. Any other comments before we move on to the next question? Any of the other panelists? In which case, let me move on to the next question. It's specifically to you, actually, Salome. It's from Helen Shikando, who's in Kenya, and she works for the Nation Media Group based in Nairobi. So she asks, how effective has been the indigenous knowledge use so far in terms of early warning systems, especially for disasters like floods? And do scientists complement that knowledge with new technologies? And if so, which ones? So a very interesting question about the role of indigenous knowledge, but also how it interfaces with technologies.
Thank you, Helen, for that good question. Yes, indigenous knowledge is increasingly being recognized in different spaces. And for example, in Kenya, in 2016, the government incorporated, the government in Baringo incorporated indigenous knowledge forecasting with the scientific forecasting, just to see the accuracy of the indigenous knowledge forecasting and the scientific forecast. And they saw that they matched quite clearly. And so in terms of whether this is incorporated within the scientific systems, there are issues in terms of how to merge all this. So the processes of merging those data is what needs to be done in terms of the scientific researchers willing to incorporate the traditional knowledge within the systems that they're working in. Because many times we find that as scientists, we run with our ideas and forget that communities are an important resource that we can tap into to help us improve or provide solutions that are holistic. So I think it's that process of ingraining the two that requires to be done to be effective in this. Thank you.
Thank you very much for answering that important question. And I think we're increasingly understanding the scientific community that in order to develop and evaluate effective interventions, we need to do that co-design with the communities involved. You can't just impose things on people. So really important message, I think, for the scientific and the policy communities. Let me move on to the next question from Isa Torrealba from Costa Rica. And it's a question about youth and what tools are being provided to young people amidst the climate change challenges. It's obviously a threat, they acknowledge, but there may also be a blessing if climate change contributes towards consciousness, brings people together, and also leads to effective solutions and makes people wake up. So panelists, please respond to that important question. Anyone like to lead off? Madeline?
So one of the investments that we've had over the last year has been on a program called Connecting Climate Minds. And it's basically been an opportunity to have dialogues in 7 regions in the world around the relationship between climate change and mental health. And as cross-cutting streams, we have had a focus, well, not we, but the researchers have focused on youth, on farmers, on fisher folk, and on indigenous communities. And quite unusually, I attended the final meeting in Barbados a couple of weeks ago. The researchers have really built a platform where indigenous knowledge and lived experience in particular is really prevalent, and it gave a very different flavor, if you like, to what would normally be an academic meeting, because it was enriched so much by the indigenous knowledge on the one hand and lived experience on the other. And I think that there are new opportunities or new ways of working together as part of this transdisciplinary approach, where the voice of youth and their experience, particularly around mental health, can be explored further, and then identifying like what are the supportive activities that will help young people not only fight climate change and look forward to a more sustainable world, but actually have the resilience and the strength to do that, given all the challenges that they face. So I think that's actually a really important research question in its own right, but we need to involve them from the start.
Okay, thanks very much. And Uduak, can I bring you in next?
Yes, so I just want to highlight some of the work that have been done by colleagues here in the Gambia, Anna Bonnell and Chris Morris. So they've done quite a lot of work on climate change and how it affects health here. And they've worked with schools. So they've, as part of their work, they've gone to schools, they've tried to set up climate change interest groups and clubs and really get the young people to start thinking about, you know, what's going on in the world, have an awareness about climate change and think about solutions. And they've really had some interesting results, but there's also been a lot of growing enthusiasm. And I think this is something that really needs to be replicated and spread. And so I think researchers in that space, in the communities in which they work, could try and get the youths to be more aware of what's going on and then give them an opportunity to share their ideas. You'd be surprised that young people have ideas that will change the world. We were all young ones, you know, and the next best intervention is going to come from somebody's thoughts and ideas right now.
Yeah, great, thanks. And I did see some of the ideas that the young people in the Gambia had, and there was lots of interesting ideas, I thought, very, very innovative and very refreshing approaches. Salome, did you have your hand up as well, or did you bring it down?
Yes, I did, but I think Uduak has kind of mentioned it, because in Kenya, we have also these clubs in the schools, from the primary schools, because we realize that when we have to make change, it has to start from the lower levels. So when we start training the children at a younger age in terms of conserving their environment, they're planting trees, then they start having a consciousness about how they can conserve their environment. And that then becomes a platform which the young people can use towards ensuring climate conserving of the environment. But also I know of the youth are also given space in some of these international spaces where the youth come together to be able to talk and champion for the rights of the youth also within the climate change space. Thank you.
Thank you very much. So let's move on now to the next question. Oh, sorry, Thierry, did you want to come in?
No, it was just perhaps to mention that I don't know if you know this kind of initiative, which are the murals. The murals are a working collaboration, and it has been developed both for adults and youngs, which is put the people together and showing how it proceeds between the the determinant of climate change up to the effect, and it involves the people and the young people to understand themselves how is the process. And I think it's a very nice collaborative work. And also, it's not perhaps restricted to young people, but I strongly believe that health could be an entry point to consider the co-benefit of actions between health, biodiversity, and climate. And it's very important to make young people understand that all these challenges are definitely linked, and it's important to work together. And health is very easy to understand. Health is affecting each of us on the day-to-day basis. And it's a bit more difficult sometimes for climate change. So perhaps it's a good leverage, and we have to work on that too.
Absolutely, Thierry. So health is a really important entry point, which I think the whole world can relate to, even if they can't relate to them all the more abstract ideas of climate modeling. So absolutely correct. I want to move on to the next question from Zulfi Bhutta at the Aga Khan University. Very important question. How do the panelists propose enhancing global support and funding for resilience and adaptation in low and middle income countries, as compared to the current pattern of investments, which is largely focusing on mitigation, which of course is important, but we also have to adapt to the change that we can't prevent. And he points out that perhaps the current funding also favours very much some of the major global multinationals and industries. So how would you respond to that critique? I think very valid critique from Zulfi Bhutta. Anyone want to have a go at that? Madeline?
Yes, so in fact, that's my wake-up question in the morning, because that is that is a huge challenge. And I'll tell you one thing that we're thinking about is that unlike mitigation, in mitigation, whether you like it or not, there's kind of a really clear, what are you trying to do? You're trying to stop carbon emissions. We're trying to keep the temperatures below 1.5 above pre-industrial temperatures. And it's a very simple index, if you like, of success. Whereas when we think about adaptation, adaptation is local, it's very context specific. It is adaptation over multiple timeframes because we are never adapted. We're always having to adapt in some way or other. So our ability to think clearly, what are the indicators of success? How should we evaluate adaptation programs? We could evaluate it over 3 years, and then 5 years down the line, the situation is different, the climate is different in some way, and they don't work anymore. So what are the indicators? How should we evaluate it? And this is the other piece that I think we should add into this conversation, is that you can't adapt to a climate that you don't understand. So you need to have that climate knowledge at the local level to help communities adapt to not only today's climate, but the climate that is coming in the coming years, the coming decade, etc. Some things you can be very flexible with. You could say, we're in a drought cycle, we'll just focus on droughts, but then you'll have an El Nino, and maybe in the part of the world you're in, that means floods, and you need to reorganize your systems, and the temperatures may rise for a certain period very steeply, and then they flatten off for a bit. It's not a simple piece. So bringing the climate community together with the health community so that they can really learn from each other, and the health community has got better information to create useful indicators and better opportunities for adaptation, for evaluation of adaptation strategies. So I think there's a lot of work to be done in that kind of cross-cutting way to support adaptation, which hopefully will help us unlock the financing that is needed to move forward to the extent that we need to. So I don't know, if that is a helpful response, but I'm very keen to think about how we can do that more broadly.
Thanks, Madeline. I'd also argue that we need to integrate adaptation and mitigation more effectively, because we don't want to create adaptive strategies that actually make it more difficult to mitigate, like putting air conditioning everywhere. Well, that has its own problems. If you do that, it's costly, it increases the urban heat island, and so on and so on. So we need to think in a systems way about integrated climate solutions. And of course, you're right, we do need to lever much more funding. We need to integrate some of the health systems funding. We need to integrate adaptation, perhaps mitigation as well, but certainly adaptation into some of the health systems funding. But we also need to think about whether new sources of funding like the Loss and Damage Fund, for example, could be increasingly used to foster climate adaptation. At the moment, the amounts of money are completely inadequate, but it's very important, I think, to argue for realistic sums into these funds that could support adaptation actions. But you're right, Zulfi, you've raised a key issue which we need to very much keep in mind. But it also brings us back to the first presentation from Salome, because the importance of indigenous and local knowledge in fostering appropriate adaptation. It's not about imposing adaptation by big multinational concerns or whatever on local communities. It's really about ensuring that we listen to their voices. Let me scroll on down the questions, because there's so many rich questions here. Dr. Wais Ahmed from Afghanistan really asked, I suppose, another key question was, how can we ensure that these strategies you've discussed today are feasible for developing countries, considering their resource constraints? So it kind of echoes a bit what Zulfi said, but focuses on how we can create, I suppose, also cost-effective solutions in low-income settings. Anyone want to respond to that? Salome?
One of the things that I would like to say is that solutions do not necessarily always have to be expensive or complex. We have some very low-hanging fruits within ourselves, within the communities we are in, and those are the things that we can champion. For example, communities have resources, their own resources on the ground. What I said is that they have their ways of adapting to the environment using some very simple skills. Why don't we tap into that rather than imposing on them something that will be very costly? Let's work with the locally available materials, the locally available resources, institutions, and work through those ones to be able to champion and provide solutions. Thank you.
Yeah, thank you very much. A very important point indeed. Well, let me move on because there are so many rich questions here. I want to get through as many of them as I can. The next speaker is about the understanding the relationship between climate change and health in more specificity. So the speaker asks, is there direct evidence on certain diseases associated with climate change so that we or our governing authority can do something? For example, can you say a 1 degree rise amounts to a certain percentage of increase in malaria, say in a particular location? I think, Thierry, you might want to respond to that, and Uduak may want to respond to others as well. So let me start with you, Thierry.
Yeah, I can start by saying that, yes, we do have for specific diseases very clear evidence of the direct effect of climate change on the number of contact, for example, between a pathogen and vectors and a host. And the publication I was referring to from Carlson in Nature showing the increase in viral sharing, it's a very good one, but you have plenty of them specific to diseases. For example, a disease on which I was working was Rift Valley fever, and there was extensive work on these diseases showing that it's not only the temperature, but it's temperature, humidity, extreme events, and it could be different from a region to another one. For example, in East Africa, it's definitely the transmission is definitely affected by humidity and rains, and in West Africa, it's more affected by the movement of animals, the pastoralism between different countries, and heavy rain in specific area where it bring together animals, vectors, and human. So you have plenty of very good study on specific diseases, but it's specific for each diseases, and it could be specifically geographically.
Yeah, thanks. Absolutely right. I mean, we also know that about over a third of heat-related deaths over recent decades can be attributed to climate change. So they wouldn't have occurred in the absence of climate change. And that's based on data from over 700 sites in 43 countries. But we're also beginning to understand more directly the relationship, as Uduak has explained, between climate and maternal health and maternal outcomes and so on, birth outcomes. I don't know if you want to comment briefly, Uduak, in terms of the specific relationship.
Okay, yes. So I really don't have off the top of my head now figures suggesting what would happen if the temperature rose by, say, 1 degree and how that would directly impact maternal and newborn health. But I think also we know that like we talked about adaptation, and so we know that geographically the weather patterns differ, and so some regions of the world already adapted to certain degrees of temperature, and so for others it's more difficult to a rise to, let's say for I know like in Gambia, for example, we've had temperatures of up to like 38, 39 degrees, and even though we complain it's hot, gradually we've adapted. Now if there was some serious event and in a place like London, for example, you had a temperature of 40, the level of adaptation is going to be completely different. And so one can't really look at it necessarily on a global scale, but it's more or less limited to the regions and what happens in a particular region. And so if there's a particular disaster, or like when you have the increased rainfall and the precipitation, like we've just seen now in Dubai, they've not had that kind of rain before. And then that happens. And then if there's something else that would lead to a change in the distribution of vectors that would transmit diseases, then you start seeing diseases that haven't been there before suddenly emerging. So it's difficult, but I think with time, as we're able to gather more data and information and see how these patterns emerge, maybe through modeling, we might be able to predict and project what could happen and how we could intervene.
Thank you. Yes, and just to say, even in the Gambia, based on the work that Anna Bonnell has been doing, in the field with pregnant subsistence farmers, we know that the heat exposure also affects the fetal heart rate directly. So at the end of a working shift, the fetal heart rate goes up quite dramatically depending on the level of heat exposure. So we can give some kind of quantitative estimates, but you're right, we still can't. There's still some gaps to fill in. There's another great question I want to come to, but Madeline, do you want a very quick?
Very quick.
For the last question.
And that is, we have a fantastic natural experiment on temperatures, which is the El Nino Southern Oscillation. So every once in a while, and we had this last year, the El Nino year means that global temperatures are maybe up to a degree warmer than normal. And that's sitting on this rising trend in temperature. So it was incredibly hot in many parts of the world. But that natural experiment allows us to do lots of research because we can see how that sudden rise in temperature, like for instance in Ethiopia, and you get this sudden rise in malaria. And when that natural phenomena drops off, you get a decline. So you can get evidence from these natural experiments that are very important for climate change itself.
Yeah, no, great point. Let me, we've only got a couple of minutes, but perhaps the most difficult question of all, actually, which you've got 30 seconds each to solve, is from Dr. Mangesh Kashyap. And he says, how can we put pressure on policymakers, lawmakers, and politicians to understand the seriousness of the situation? But they're not doing anything. They've got a fear of losing elections, so they're not doing anything. How do we create a sort of tidal wave of pressure that will make them do something? So only got 30 seconds each to respond to that really important question. Who'd like to start?
Make sure they lose the elections if they don't do anything.
What?
Make sure they lose the elections if they don't do anything. So the public have got a real responsibility there.
I think particularly young people to influence, because there's often the older people that are actually not thinking of these issues, and they've got a great potential to perhaps influence their parents and grandparents and uncles or whatever. So next,
education will be key for sure. Education, is very important. And then you have to choose either to fight against the political people or to be involved in the interaction to try to push from the inside.
Yeah, that's a crucial decision which all scientists have to decide. Salome, what about you? What's your response?
I would also say that as scientists, we need to work with communicators to package our information in a way that then addresses the needs of the policymakers. Thank you.
Absolutely. And Uduak?
Well, I don't think I have much different to say. It's all about knowledge. Knowledge is power. And once people have knowledge, they're empowered and they can demand, what should be done from their politicians. Well, in truly democratic societies.
Yeah, of which there aren't many, but we have to keep striving for that. But yeah, if I can just add, I think the other important thing is having a positive message, because what we do know is that just telling people it's all going to be disastrous doesn't necessarily change people in the right direction. In fact, sometimes it fosters populism and so on. So we need to have solutions. We need to create a kind of vision of societies in which people want to live that are climate resilient, adapt to climate change, but also at a much lower level of environmental footprint and are much better for our health. So working to create that positive vision towards which everyone can aspire may be one way forward. But we have to stop now. It's been a fantastic session. We've had wonderful panelists, fantastic questions and answers, really could go on for a long time. But let me just ask you to join me in thanking all the panelists, because I think they've been great. And to thank Lauren and colleagues at Nature Springer for sponsoring this event. I think it's been a really great event. We could go on for hours and hours, but thank you so much for listening and participating so actively. Bye.
Bye. Bye.
Thank you so much. Bye.
Bye.
Bye.